Hi everyone, my name is Brenna. I'm a PhD student from the University of Toronto's DGP and Chai labs. I'm here to present our work, Beyond the Waiting Room, Patients' Perspectives on the Conversational Nuances of Pre-Consultation Chatbots. Many of you have probably been in a situation like this, where you're waiting in a waiting room among a dozen of other patients looking to seek care from a doctor. Sometimes it's a 20-minute wait, but often that can stretch to several hours long if you're at an urgent care facility such as an ER or walk-in clinic. Sadly, the experience often doesn't get better even when you're in the consultation room. Due to the overwhelming burden of documenting into EMR systems, many doctors are seen typing away during their consultation with patients. This means that patients are often left staring off into space or talking to the doctor's back while they're trying to explain the different symptoms that they're experiencing. This often leaves patients feeling anxious and disconnected from the doctors, creating a rift in the patient-physician relationship and trust. One way existing literature has tried to address this issue is through pre-consultation information exchange. This means information is exchanged before the patient and physician actually meets. What it looks like is patients will describe their reasons for the visit and any medical background they would want the doctor to know about. The doctor will review this information such that when they're in the actual consultation, it streamlines their conversation. As you see, studies have shown that by streamlining the conversation, it helps prepare both patients and physicians for the appointment and eliminates the initial get-to-know-you phase where doctors are trying to understand what the patient is here for. Studies have also shown that by having pre-consultation, the consultation exchange, the appointment becomes more efficient and effective, leaving both parties more satisfied.
Existing methods for pre-consultation are usually of two extremes. On one end, you have surveys. These are easy to scale, easy to deploy, and cost-efficient. However, the questions are often static, which means that they may be disengaging, cause uncertainty, and may result in lower response quality. On the other hand, you have medical staff. These are medical personnel trained to conduct pre-consultation, which means that they can engage in more dynamic questions, a more engaged interaction, and result in higher response quality. However, it's difficult to train these medical personnel, so it's difficult to scale, difficult to deploy, cost-efficient, and in a situation where already short-staffed, it's difficult to allocate resources from medical staff into pre-consultation.
Which leaves us wondering, what about chatbots? LLM-based chatbots have the potential advantages of both surveys and medical staffs. It's easy to scale, easy to deploy, cost-efficient, can ask dynamic questions, and have engaged interactions, and as studies have shown, have higher response quality than existing surveys. However, how do we design our pre-consultation chatbot that patients would want to use? To answer this question, we first set off to understand what are some goals of pre-consultation and design an instruction manual that we can feed our chatbot agents. This is the set of instructions that we came up with from the literature and from iteration with our medical collaborators. This can generally be summarized into two buckets, where the first half is about how the agent should behave and what it is expected to do, and the second half being a list of commonly asked pre-consultation questions that we source from the literature. These include questions like reasons for visit, medication history, family history, for a total of 15 questions. We gave the same set of instructions to two separate conditions. We have an AI agent which is powered by OpenAI's GPT-4 and Wizard agent which were medical graduates. We want to caveat that the GPT-4 AI agent was supervised by our research staff so that no personal identifying information was leaked to OpenAI. We also want to emphasize that the goal of the study is not to determine which of these two conditions is superior, but more to contrast them as two separate instantiations of a conversational agent based on the same set of instructions. The conversation then took place over a HIPAA-compliant conversation platform, HiSide. We then went to a real-world clinic where we recruited patients to test out this interaction. The clinic we work with is located in the Greater Toronto area and serves roughly 100 patients per day. At the clinic, we were able to recruit 4 physicians, and during each of their shifts, which last around 6 to 8 hours, they would see around 30 patients. Of the 30 patients, we had roughly 10 patients interested. 5 of those meet our requirements, which means that they were above the age of 18, fluent and comfortable conversing in English, and is therefore a new symptom. Of those 5, at the end of the day, we were only able to recruit 3 to 4 patients. After about 6 weeks, we were able to enroll 33 patients. Of those, 17 were assigned to the wizard condition and 16 to the AI condition. The following describes the procedure that every patient participant went through. They first filled out a pre-study survey asking them about their background demographic information as well as their proficiency with technology. They then conversed with a pre-consultation chatbot agent. This could have been the wizard or the AI. After their conversation, we asked them to fill out a post-study survey to gauge their experience and feedback from this interaction. During this time was also when a summary was generated for physicians to review before the consultation. Then the patient proceeded with their consultation with their physicians, and afterwards, if they were interested, they were recruited for an optional interview. Study findings. Patients' receptiveness. We found that most patients had positive experiences from the pre-consultation chatbot. In a post-study question asking, how willing will you be to use this chatbot again at your next visit, we found that more than 60% of our patient participants saying at least most of the time, and didn't matter if they were in the AI condition or wizard condition. We also found that this experience helped patients prepare for their appointment. In a quote by participant 18, they said that the experience made them think about how I was feeling before I went into the appointment, so I have a better answer for the doctor. Like it was asking me how long my symptoms were and had to think about it. I wouldn't have had the answer if the doctor had asked me. We also looked at the conversation turns and word count. On the left, you see a comparison in terms of messages sent in the AI condition and wizard condition between agents and patients. We found that there were significant differences, meaning that there were significantly more messages sent in the wizard condition than there were in the AI condition in both patients and agents. In contrast, we did not see any significant differences in the number of words exchanged between these two conditions. To investigate this further, we decided to code the agent's messages by utterances. These utterances were of 3 categories: questions, empathy, and explanation. For the sake of time, we'll only focus on one example from each of these categories. Please refer to our paper for more detail. Under the question category, we have follow-up questions. These were questions that were not part of our 1 to 15 question list. We see on the right that the wizard agent asked a lot more follow-up questions per conversation than the AI agent did. Moving on to appreciation. These were language such as thank you for telling me this, thank you for this information. We noticed that the AI agent in this case sent a lot more appreciative language than the wizard agent did. Finally, on informing context. This was coded for when the agents provided explanation for reasons for why questions were being asked. We see in this case the AI agent was also more prolific in explaining the context of a question than the wizard agent. To provide more concrete examples, we show a dialogue between an AI agent and a patient on the left and a wizard agent and a patient on the right. As you see on the left, the AI agent was still good at asking follow-up questions when it realized the response given was vague. In the question, do you use tobacco, alcohol, or recreational drugs, the patient originally replied yes, without any specifics to which one. The AI agent then knew to follow this up, so to prod the patient to get more information from them. On the other hand, we see a different type of follow-up question where the wizard agent knew with their medical knowledge that when a patient provided information about their back pain, they knew to ask, does this pain come when you're sitting down or standing up? As you can see, while they're both follow-up questions, the depth of the questions is significantly different when the patient was speaking to the wizard than when they were speaking to the AI on the left. The lack of follow-up questions was also noticed by several patient participants. In a quote by P25, who was also in the AI agent condition, they mentioned that maybe the follow-up questions that the chatbot can ask are not quite as specific as a nurse would. When I asked about my family history and I said my mom has several allergies, it didn't ask what those were, and I was kind of expecting it to ask that. As you see in this case, the patient participant provided information that they had expected to be followed up upon. But when the agent didn't follow up on it, they were quite confused. Regarding the empathy and tone and the use of appreciative language, we noticed that without explicit instructions on providing empathy, the AI agent was sometimes too empathetic, appearing almost insincere. In a quote by participant P17, who was in the AI agent condition, they said that I'm so sorry to hear that. It just seems so very fake. And thanks for my honesty. What is it? Am I hiding that I'm an alcoholic? That part was weird. As you see in this scenario, when the agent kept saying, I'm sorry to hear that, thanks for saying this, thanks for your honesty, that comes out as too empathetic and almost the point of disingenuousness. Finally, on informing context and expectations, we found that patients' understanding of chatbots often impacted how they interacted in the conversation. In the case with participant 14, who was in the wizard agent condition, their impression of the chatbot impacted how they responded. As they said, my responses were short and not too detailed because I know it might be a little tougher for the chatbot. Like, does it pick up all these little details? So yeah, maybe I was holding back. This indicates that future studies need to do a better job at informing the capabilities of the chatbot so that patients know when not to hold back and convey all the information that they may want to convey to their doctors. In summary, we started off this project by trying to understand how do we design pre-consultation chatbots. We're curious to learn how we can design a chatbot that can converse with patients and gather information from them while they're waiting in the waiting room. From a study in a walk-in clinic with 33 real-world patients, we found that patients were generally very receptive of this interaction and found the chatbot helpful for their appointment. Through this study, we also found some major takeaways that future designs should consider. 1. Ask more insightful follow-up questions. 2. Convey empathy in a genuine and sincere manner. And 3. Communicate chatbot capability and pre-consultation expectations clearly. Now this concludes the presentation. Please refer to our paper for more detail and reach out to us if you have any questions. Thank you.